I'm Ashley McDonald, and I'm the Public Information Officer with Murfreesboro Fire and Rescue. Our firefighters have a very tough job, and today I'm putting myself in their boots to see just how tough it is. On Adventures in Firefighting. Welcome to this episode of Adventures in Firefighting. Today I'm going to be talking to Assistant Chief Kim Lawson about our in-house advanced EMT class. I'm also going to be learning a very important life-saving skill. So Assistant Chief, thank you for being with us today.
Thank you for having me.
You're welcome. So tell us a little bit about the advanced EMT course and how important it is for our personnel to take part in that.
Well, we are just finishing up our first ever in-house EMT program. We started out last January with EMT class that was taught by instructors from Motlow, Motlow State Community College. They provided the instructors and some equipment, and our personnel finished the first segment, and they went on to the advanced EMT section, which they're just finishing now.
That's great. And I was actually able to bring my son, who's 4 months old, to one of the classes. And tell me the importance about them having a live candidate or live body there to kind of examine and to use for instruction.
Well, one of the things that in the EMT program, there are a lot of skills that they have to perfect. Of course, you have to perfect those skills before you get out with real patients.
Absolutely.
And you know, about 75 to 80% of what we do here when we respond to a call is a medical call. So perfecting those skills is really important. So they practice on a lot of mannequins. They'll check each other's blood pressures and vital signs and things like that. But working with a baby is really different. The first thing is that it causes a lot of anxiety when you encounter a really sick baby or one that's not breathing. So practicing with a mannequin versus practicing with a real baby is a lot different. So you bring in Corley to class for us to assess and to see. That's really helpful for people to get an idea of certain things, like when a baby's crying, that's not really a bad thing when you're looking at it from a medical standpoint, because you know their airway is open. Their heart rates are different. They're faster than adults. Their blood pressure is different in that they're lower, and they can choke much easier because of a small airway, which is a big danger with babies and infants. So you know, their skulls are not formed, they have not quite grown together, they're fontanelles. So knowing about that, just their skin temperature, babies lose a lot of heat very easy, so it's really important to keep them warm. So it's really beneficial when they get to see a baby, and we appreciate you bringing Corley.
I think for some of them it was the first time even being that close to a baby. You could kind of tell they were a little bit timid about it, but others just went right on in there, and it looked like they were really enjoying that particular day of instruction. So
he not so much. He was okay, but he didn't. He was ready to interact a little bit more. But you know, getting those skills perfected before you handle a baby when you're anxious is really important. So there are a lot of things that new mothers can do, and that is to learn CPR. There are agencies that offer that through the Red Cross or the American Heart Association, and there are some other companies that actually teach CPR. It's something that would be really good. First aid classes, because babies are different. You know, a baby cannot lose the same amount of blood than an adult, because it'll have drastic effects on a baby.
Obviously. And not only maybe for new mothers, but also caretakers, like my mom and my mother-in-law keep my son. So just having everybody that's involved with the young baby's life, I'm sure it would be beneficial for them to also take those classes.
It would. We would highly recommend that. We have a lot of advanced equipment, and we have protocols and all of that, but the very basic and the thing that is the most important is good CPR.
Okay. Well, I understand I'm going to be learning about basic baby CPR, infant CPR from one of our training coordinators, Jeff Wright. So I'm here with Training Coordinator Jeff Wright, and he's going to be showing me some basic infant CPR. Jeff, as a first-time mom, what are some of the things that I need to look for to indicate if my child is in distress?
Okay. Most of the time, if you're going to be faced with an emergency at home like this or something, you may come in and actually witness the baby there in the crib or something when you come up to them. So I guess what we really teach and what we really stress when we're doing this is to actually go in. You want to try to stimulate the baby. We're going to tap the feet or do something as far as maybe shaking just to make sure that the baby is not sleeping at that point in time. Something that you could actually also witness when you come in, you may see some cyanosis around the lips and things, and that's where the blueness from the lack of oxygen could be present. So that's really a sign that we usually, when we arrive, we see a lot of times too. So the family member, you know, they come in, they're going to be very distressed, and their adequacy of CPR, if they've not been trained, is probably not going to be the best in the world at that point in time. So, you know, just some of the real basic steps to go through could make the difference whether the baby is going to survive or not. So.
Okay, so I've come into Corley's room, and he's laying in the crib, and I've tapped his foot, and I noticed that he's got a little bit of blueness around his mouth. So at this point, what do I do first?
Okay, at this point in time, you would probably go ahead and take him, and you want to move him to a firm surface.
Okay.
In order for the CPR to be adequate and things like that, you need to have them laying on a firm surface. Okay. Some teach to actually hold the baby on your arm, and a lot of that's going to depend on the size. I mean, if the baby's 20 pounds or something, it may be difficult for you to actually hold here. So what we really like to teach is actually getting the baby placed on a firm surface at that point in time. What you would do after you get the baby placed here is you want to put the head in a sniffing position.
Okay.
We're trying to open the airway here. We're trying to take care of the cyanosis that's present. So you're going to open that up, and you're going to, you know, you'll see if the baby were to start breathing and stuff, you're going to see some rise and fall on the chest and things just by simply opening the airway.
Okay.
That could be the only problem that you would have to deal with. It could be from an airway occlusion because the baby's head is so much bigger to the rest of the body that when they are resting like this, a lot of times they tend to lean forward, the chin down on the chest. So by opening the airway, they could start breathing at this point in time. If they do not, then we kind of have to step it up here. You can check a pulse. You're going to check a brachial pulse, which is going to be here in the bicep region. It's going to be kind of in between the muscles here. So you could actually take it there to check a pulse too.
Okay.
So once you establish that the baby is not breathing and does not have a pulse, you're going to start compressions at that point in time.
Okay.
For a layperson CPR. So what you're going to do, your landmarks is usually mid-nipple line, you're going to go about one finger below. Here, you're going to take two fingers and you're going to compress straight into the chest about a third of the depth of the chest, which is around 1 to 1.5 inches, depending on the size of the infant at that point in time. If your hands are very small or you're having trouble controlling them, you can do the encircling technique to where you kind of lace your hands behind the baby and do your thumbs and stake your thumbs there in the same area.
Okay.
So your landmarks is going to be nipple line. That's an imaginary line that we do teach, and you're going to be about 1 finger width below that, right in the center of the chest.
So about right here. And I mean, does it matter which two fingers, just as long as you can get the pressure?
Right. We just need to make sure that we're getting good compressions here. One thing when you are doing your compressions, like I said, about a third of the depth of the chest is about 1 to 1.5 inches you're actually going to press in. You're going to do this at a rate of 30 compressions here.
Okay.
Once you deliver those 30 compressions, you're going to deliver 2 breaths. So what you're going to have to do once you complete your compressions, you're going to have to come back in and open the airway back up, and you're going to give 2 real slow ventilations or breaths into the infant at that point in time. You always have to be careful because if you overinflate, the air is going to go into the stomach, and anything that may be on the stomach is going to come back in and include the airway. So here, the sniffing position, just enough breath to get chest rise and fall is really all we're trying to accomplish at this point in time.
Now, when you're giving the breaths, I mean, I have had CPR training in the past. Is it still, I know that at one point you were having to do it over the baby's nose and mouth. Is that still correct?
And that is still correct.
Okay.
That has not changed. So what you would do is you would actually take your mouth and put it over the baby's mouth and nose at the same time to complete a seal here. That way you're getting all the air down into the baby's lungs. So you're going to do this for about 2 minutes or 5 cycles. The recommendation is for 100 to 120 compressions a minute.
Okay.
Your adrenaline's going to be high enough, you're probably going to be able to provide it, especially if it's your own child.
Absolutely.
So here we're going to do the compressions. So you're going to do 30 compressions and 2 breaths. And like I said, hopefully the first response unit, whether it be the fire department or EMS or whoever it's going to be that's going to arrive there, hopefully within the first 4 or 5 minutes, that maybe you'll get through this the first time. One thing that's a little different from what we would teach you versus what we're going to do, we're going to come in and actually use this. It's called a bag valve mask. So this is a piece of equipment that we would actually use when we come in to do the breathing too. And one thing too, This, you can kind of secure here and do your breaths this way. There again, we're looking for chest rise and fall is really all that we want to do there, because we don't want to overload the lungs and cause the air to actually go into the stomach. So that's really it. About every 2 cycles or 5 minutes or so, you can stop to see. You should see some improvement when you start doing your ventilations and stuff, and you're doing your circulations with the cyanosis and stuff present. That's a good indication that your CPR is effective at that point in time.
Good. So obviously this is a very good skill to have, being that you could do this before the first responders get there may make all the difference.
Okay. So one thing too that we'll talk about real quick, the rates that we want to do this, the 100 to 120 compressions a minute, that is a recommendation that just about every company that actually sponsors the CPR stuff, like American Heart and Red Cross and things like that, that's what they want you to do.
Okay.
That's what it takes to be able to make sure that we're going to circulate that oxygenated blood throughout the system to feed the brain and things like that too.
Okay.
The breaths, like I said, 2 breaths, or if the baby were to maybe have a heartbeat and just not breathing on their own or something, you can do rescue breathing at this point too.
Okay.
That should correct the cyanosis, and your rescue breath should be done. You should deliver 1 breath about every 3 to 5 seconds if it's just rescue breathing alone.
Okay.
But what we're concentrating on today is more CPR.
So Jeff, will you kind of walk me through a scenario so maybe that I can see how some of these rates of breathing and the compressions go?
Okay. All right, so first thing we want to do when we come in, we need to establish unresponsiveness. We want to make sure the baby's not asleep, so tap the foot. At that point in time, if you get no response, you obviously want to go ahead and open the airway at this point in time. Okay, we're going to look to see if we...
Now, am I doing it like I normally would do in an
right,
adult? Like
you
just
can. The biggest thing with this
is
is make sure that you stay in the sniffing position, because if you hyperextend, you're going to cut the airway
Okay.
off too.
Okay.
So basically they're just in a sniffing position. Once the airway's open, you don't see any breathing, there's no pulse or anything. At that point in time, you will want to go right to your compressions.
Okay, and so I find the
Yeah,
nipple line.
and you don't have to hold the head if you can do good compressions and stuff.
Okay.
If you can, that's kind of a user preference. So those compressions, you're probably going to have to speed up in order to get the
Okay.
100 to 120 per minute. Like I said, if this was a live case, I know your adrenaline is going to push you to where you're
Right.
probably going to be able to do that. So here you're going to go through 30 compressions, then you're going to do 2 breaths.
I wasn't counting, Jeff, I'm sorry.
So
So I understand there's
you're
a
gonna
little
have to
trick
probably
to this
speed
too.
up a little more. So what you would do here is actually there is a rhythm. There's different songs that are out that you actually can do that to. Some of
Okay.
the training materials we use does have music to it to kind of put you in the rhythm of doing the compressions and stuff
Okay.
too, just to show you how fast it has to be done.
Okay, what are some of those songs, Jeff?
One of them, I guess the biggest one that you usually see is Staying Alive.
Well, that's a good theme, so let's go with that
We're
one.
going to go with
You-
Staying
you
Alive.
gonna sing
but
it for me?
I am not going to sing because everybody will be turning us off at that point in time. So here we're going to do 30 compressions, and it's got to be pretty fast. I mean, you got to make sure that you've got good depth, because remember what we're doing at this point in time, we're circulating blood.
Right.
We're feeding the vital organs of the baby. So once your 30 compressions are in, you want to go back to the sniffing position at this point in time, deliver your 2 breaths. Remember, you are going to seal your mouth around the baby's mouth and nose to make sure that you have a good seal at this
Since
point
it's
in
not
time.
my baby and I don't know where his mouth and
Right.
nose is
So
being, I'm not
we'll
gonna do that.
simulate that is going to be done.
Okay.
Okay, your 2 breaths are in, you're automatically right back into your compressions. So this is kind of a systematic thing, and once you get rolling with it, it's going to go very, very fast. Like I said, your adrenaline is going to make you probably do more compressions than you would have to.
Right, because it's
But
hard to count and sing at the same
It
time.
really is. And I mean, you're going to be so distraught at this point in time too. You know, everybody always asks when we do teach classes and things like that for even our people, you know, they talk about the number of compressions and stuff. It is very hard for one person to do CPR to make sure that you're doing it effectively.
Right.
You know, once somebody does arrive, or if you have a family member there with you, you can go and do a 2-person CPR at that point in time. And where we were talking about doing the encircling at that point in time, whoever was going to do the compressions can put their hands around the baby and stack their thumbs here and do your compressions. One thing about doing a 2-person CPR, you're going to do 15 compressions to 2 ventilations, because you're
Okay.
going to be faster this way.
Okay.
So you're going to have somebody actually ventilating and compressing the baby. But if you were at home by yourself, 30 compressions to 2 ventilations, and you're going to do this until help does arrive there.
Okay. Well, that's some great information to know. Thank you so much, Jeff, for teaching me this basic skill, and hopefully this will not only help me, hope I'm never in that situation, but hopefully somebody out there watching the show will also get some good information from this.
Very good.
But it doesn't beat actually getting certified in CPR, right?
Exactly, and we do recommend that for everyone. American Heart, Red Cross, and there are several companies here in Murfreesboro that actually go out and does CPR training. So we do encourage, the public to get this training, because this could make the difference, for a family member.
Absolutely. Well, thanks so much. Having Corley be a part of a hands-on training exercise for our AEMTs was an adventure itself. It was also an educational experience for me. I'm thankful to both Kim and Jeff for the opportunity to get educated on this basic but very important life support skill. If you are a parent or caregiver, I definitely recommend becoming CPR certified. It may make all the difference.